Absolutely. It's 50 minutes.
They're right outside. Oh,
I might need to have a copy of that because like a not cool kid, I'm not finding it like I thought I would.
Can we make a copy in the office of the agenda?
Yes. Board of Supervisors, Board of Disability, Health Services,
Can't
Board
find
of,
ours.
no, I can't find her.
Okay, cool. Yeah, mine, I don't mind it.
Oh, yeah, it's just-
Open meeting. Sometimes we are putting something out, we can do this time.
You just haven't seen that person in a long time.
Busy, busy, busy.
I know. Actually, I was like, I actually can come in person tonight. So it's fine. That's about, which thankfully they started hopefully holding off for. Like, I said to my husband, you're gonna be home tomorrow with kids, you know that, because
The wonders of technology.
one of us is gonna have to. I took the last one.
Okay,
That
so
last one was bad. It's
Mm.
beautiful.
I'll sign in as a host for both of them.
We don't have a snow thrower I mean, my husband and I are the
And I
snow
signed
throwers.
in as a
because he
guest.
broke
I
our old one
literally
and
just
we
went through
just
this with Darren and them.
Bought a new one. Thankfully, one neighbor found us kind of up and another neighbor kind of helped us out because I think they felt sorry for us. Yeah. It's funny because I work in Clinton a couple days a week and I. Cooley? No, not Cooley, Michigan State Law, yeah. Cooling partnered with Michigan State before they got. the
Before,
laws.
and then Detroit College Law partnered with.
Yeah, because we were there with Cooley partnered, and then the law school was just forming, I think. So, anyway. They're not always there. So, but you find, I got it on my phone. So,
Right, it's 4:32, so I will call the meeting to order. It is Wednesday, February 15th, 2023. The time is about 4:32. This is our regularly scheduled meeting of the Dubuque County Board of Health. I am Sandra Larson, the current chairperson of the board. I will take roll call. Adam Hoffman is not here, and neither is Pat Lemkuhl. They both had conflicts tonight, and so they will not be present. Dr. Hendrik Schultz. He was on.
he was on.
Jess Smith,
Here.
Amy Crow-Sunley,
Here.
and Sandra Larson is here. Mike Fidgeon is about 4 minutes out, and he'll be here soon. So once he arrives, we'll have a quorum here in the room. And I hope Dr. Schultz can come back.
This card just.
Okay. Next, this is the time for public comments. At this time, anyone may address the board on matters of which are on the agenda. Please raise your hand on Zoom or stand up and state your name. If you're in the room, stand up and state your name and home address. We do not need the number address, just your street. And individual remarks are limited to 3 minutes. Is there anyone that'd like to speak on something that's on the agenda tonight? Yes, your name, please.
Evan Hudson. I
And
live on West Third Street, Dubuque. I'd like to address action item 8A, the MAT agreement with Mercy One.
yes,
I'm the program coordinator for Dubuque Harm Reduction. So part of the services that we offer is connecting program participants to medication assisted treatment like Suboxone and methadone. And one thing I've heard is that sometimes MAT programs put barriers in between people that these programs are designed to serve and the services that can help them and save their life. And so I would encourage the Board of Health to think carefully about how these barriers can be removed. An example of what I'm talking about is sometimes, for example, in order to get on a Suboxone program, it requires requirements to go in for weekly treatment or counseling sessions and so forth. Sometimes the clients don't have transportation or they work at that time. So one example of what I'm talking about is working with clients instead of having a one size fits all program to come up with individualized plans of care in order to remove
I
these
can't really
barriers.
see it on the screen. It's a little blurry. But it goes
Now
every
I have your ear,
week.
if you don't mind.
So my
I
question
talked to
is,
Representative Chuck Eisenhart yesterday, and he encouraged the county board of health to reach out to Joel Fry, who I understand is in charge of the opioid settlement money for the state. Inquire of Mr. Fry how the opioid settlement money that the state legislature is controlling is being spent. And if possible, to coordinate with other.
Yeah, we can get that
boards of health
added.
from other
I'll work with Heather on that
and
and
I'd be
see
happy to help with that
some
if
of the
possible.
questions that we have.
and thank you very much.
Sure thing.
At the end of this year, if that's in alignment with what she wants.
This is Supervisor Ann McDonough, and we need to have MRC online mute themselves, please, or someone in the boardroom needs to
This
do
is
that. We can't hear the comments in the boardroom at all because MRC is overriding everything. Thank you. So Evan, this, I know you well, and I appreciate you being here tonight. Sadly, more than half of what you said was lost. So it would be beneficial to me. I guess you and I can visit privately as we have before, but for the greater good, your comments were lost to the folks that are on Zoom.
You can go ahead and restate them if you like.
Summarize, sure.
Sure.
The MAT agreement with Mercy One, I was encouraging the Board of Health to think about ways that barriers to MAT access can be removed. One suggestion is coming up with individualized plans of care so that people who are trying to get onto, for example, Suboxone can find a way that that works with their schedule. And then I also shared that Representative Chuck Eisenhart suggested or requested that the Dubuque County Board of Health reach out to Joel Fry in the Iowa legislature to inquire how the opioid settlement money is being spent, the portion that's controlled by the state.
Thank you.
Did that come through?
Were you
Yes.
able-
Thank you.
Sure.
Okay, are there any other public comments concerning anything that's on the agenda tonight? I don't see any, so we will proceed then to chairperson announcements. The first is the update on the budget presentation to the Board of Supervisors that was given in late January. Amy Crow-Sunley, Stacy, Laura was there. I was there. We gave a presentation, and I just would like to thank Laura, Stacy, and Amy for their fine work, and of course, our director. Our director was formally introduced to the public there on that particular day too. So a very nice presentation. They gave a very nice presentation. We haven't heard yet. I don't think the supervisors have acted on our budget request at this point, but that will be happening soon. So, and next, the strategic plan update, and I do think that Ally is going to give us a little update on that too, but we've been meeting every 2 weeks. Ally has completed a request for a proposal, and that's been posted, I believe, and she'll update us a little bit further, but we are going to continue to meet every 2 weeks and get this off the ground. So we're continuing to work on that. And then a couple other things I wanted to say today. Our goal here as the Board of Health is to prevent, promote, and protect the public health. And I just wanted to mention something about active shooters tonight. I graduated from Michigan State University with a law degree. And of course, we all know that they had an active shooter this past week, and it's very sad. It is a problem in our country. There have been, in 2020, there were 45,000 gun deaths in our country. That's about 124 a day. And I just want to call that to everyone's attention and also just state that this is a public health issue. And I'm just amazed at what we are teaching our children. Run, hide, and fight, for God's sakes. And then I wanted to bring your attention to Stop the Bleed. And this is one of those type of kits, I believe. We, as the health department, gave these out several years ago. These are called a crisis kit. And I'm just,
Please offload them up.
I think that we maybe should update
Need
these
butter,
and make them
butter spray.
Stop the Bleed kits. Somebody needs to mute out there in Zoom land. Just as we do start our strategic planning, I think we need to keep this in mind. Gun violence is a problem. Our state legislature is spending a great deal of time this year on don't say gay and putting their thumb on transgender children. But I don't see anything being done about gun safety. So I think it's something that as a public health problem, we need to address it. Those are just my statements. These are not the statements of the Board of Health. These are just Sandra Larson's statements. Those are all the announcements that I have today. Next, we have the Board of Supervisors, Board of Health liaison comments.
Good afternoon, everyone. First, thank you for those comments, Sandra, about school violence. We did have a presentation at the board meeting from the sheriff and from emergency management that identified that they had received, each school had received $50,000 to do safety planning, and that those funds and those improvements were being made as we speak to schools in the state of Iowa. And my question to the sheriff was, did he think that that money was making our schools safer, and they actually felt that it was a positive thing to report for school safety. So I would just share that to you as a timely message. I also thank Evan Hudson for his comments tonight with regard to this proposal from Mercy One. I would give you maybe a little bit of context as a supervisor. Mercy One has applied for what we call purchase of service agreements. And that's in fact what's in your packet tonight, that Mercy One has done that several times for the MAT program, and they did not do that in the last opportunity. Instead, or in addition to, or all the same, we did receive an application for significant funding for the Mobile One unit, and the supervisors did approve $300,000 through ARPA funds to Mercy One for the mobile unit. And during that presentation, there was some comment about how that would also help with opioids. So I'll just leave that there. We do not have a funding agreement with them. There's some funds that have been expended outside of the contract. There's been, I'm not sure I understand exactly what's in the packet with the notes from someone about the various who changed what invoice. Obviously very messy, but I just want to make sure you understand that entering into a contract with Mercy One tonight is really not an option. That would be through purchase of services, and that is with the supervisors, and there will be opportunity for them to apply for that sometime maybe in 6 weeks. So there's a mechanism for that. I would also just like to say about the opioid group. I know that Allie will tell us tonight an update about the subgroup that's being made of the Board of Health. And I would just encourage that group. I don't know whether in the MAT, which I understand also is now being done by Crescent Community Health Center to some extent. I'm not sure what Evan means by removing barriers. He would be a person who would be likely to be part of that subgroup if you want to have community members also be on your subcommittee. He has great experience to share and has been persistent throughout the pandemic and doing strategic work. So I think those meetings will need to be public. There's a great deal of public interest. So that, because it's a subcommittee of the Board of Health, all of that would need to be happening in public with advance notice and publications and so forth. And then the last thing I wanted to share with the group tonight, I see that Catherine Caitlin is on Zoom with us. Catherine was just elected on Monday as the new chair for the Dubuque County Food Policy Council. And they have also decided to hold their meetings on a quarterly basis this year, hoping to connect and build some strategic relationships with the Board of Health. I think that some things that are in their mission statement, and they have a brand new professional strategic plan, there are some things that I think align with comments that I have heard from members of the Board of Health. And so they have been meeting monthly, but feeling as if they're not making really any progress, waiting for the health department to kind of, help maybe with minutes, provide some structure. But we do have a new chair who's quite energized and also has a legal background. She's a practicing attorney working with immigrant populations. So I think when you're ready, I hope when you do your strategic plan, you'll reach out to the Food Policy Council, perhaps for some input or some training and education, maybe before you address some of those food issues, because they're in the trenches doing that work. So I always appreciate everyone being together and the work that you do. So I'm a resource here tonight. Supervisor Potoff is actually also on Zoom. Typically when he and I are together, we are careful with our comments because we don't either of us speak for the board, but also we form an electronic quorum. So we would need to answer questions, but we can't enter into any kind of philosophical, conversation about one way or the other. So thank you.
Thank you, Supervisor. The next item on our agenda is the approval of the agenda for February 15th, 2023. Is there a motion? Second. It has been moved and seconded to approve the agenda. Is there any discussion? Hearing none, we'll take a vote. All those in favor of approving the agenda, say aye. Aye. Those opposed? Thank you. We have approved the agenda. The next item on the agenda is the approval of minutes, and we have two sets from January 18th, 2023, and then the special Board of Health meeting on January 23rd, 2023. Is there a motion to approve those two minutes?
I move we approve the minutes for both of those meetings.
Thank you. Second,
Second.
is there any discussion? Hearing none, we'll take a vote. All those in favor of approving the minutes for January 18th and January 23rd, 2023, please state aye.
Aye.
All those opposed? Hearing no opposition, they are approved. Next, we will have presentations and reports. First, we will start with the Health Department monthly update from Laura McCarthy-Cone and Ally White.
Thank you. I'm going to share my screen. We've had some discussion about septic and well permit. And I thought it would be beneficial to, if I can get that file open, to show the revenue generated from septics and well permits. In FY22, a total of 146 permits were purchased for total revenue of 27,000. And you can see quarters 1 and 4 are the busiest times. Obviously, the weather's nicer and such. Though quarter 3 isn't that bad for being from January to March. Thus far in FY23, 53 septic permits have been purchased, 33 in quarter 1 and 17 in quarter 2, and just a few thus far this quarter, for a total of 13,250. FY22 well permits that were purchased, a total of 37 permits. Wells permits are not as we don't see as much of those as septic, but still at 37 permits purchased in FY22 for a total revenue of 67,000 be nice too. And then thus far for well permits in FY23, just 21 for a total of 5,250. Just to give you an overview of the kind of money that those permits generate. And it's getting that time of year. Bailey is setting up appointments for tank inspections. Lost the word, Ally. Pump tanks inspections that she'll start hopefully soon here. And that is all that I have right now.
Laura, some time ago, we talked about checking into having the ability to take credit card payments here at the health department. Are you following up on that at all? Or
We are, Ally and I and Bailey, yeah, we
Okay.
just talked about it actually today.
Great.
We need to get with, Ally's gonna get with, I believe the treasurer's office to see
Great.
about getting that.
Thank you.
Thank you.
And then Ally White from the health department.
Thank you. Are you able to share the PowerPoint, please, Laura? So as the slide shows here, we do continue as a department to strengthen our community outreach. Those are 6 different events that we had attended in the community. We met since we had last met, since the last board meeting. I attended a mayor's meeting and also a tour of the solid waste agency. Bailey and I did that along with Supervisor Kennegar. Met with the Military and Veteran Health Advisory Group. Also had the opportunity to tour the Dubuque VA clinic. Lots of good work being done there. Did make a connection with the MHDS service. Amy and I had met with May, and then we also toured the A New Day clinic on Asbury Road, part of Hillcrest. So lots of good things being done there as well. We're well aware that we are looking to embark on strategic planning. The first part of that is to get a request for proposal out. I actually, just before this meeting began, sent the proposal to be posted on our county website. And what that will do is enable consultants to apply if they're so inclined. And I think we had a deadline to apply for March 17th. And that would kind of set us up to begin the actual planning process shortly thereafter. The opioid settlement funds. We are looking to form, a small subcommittee of those listed on that slide, and that the first subcommittee meeting will be occurring within the next few weeks here. Just a brief COVID-19 update. We are in the process of completing an after action report, and that was through a consulting firm who is guiding us through that process. And you'll see that the emergency preparedness meetings have transitioned to be included as part of the bi-hospital infection prevention subcommittee meetings. Again, they're held bi-monthly. Community health assessment and community health improvement plan is a requirement for local public health departments. And we are currently working with the agencies listed on this slide as part of a steering committee. Our first draft is complete. We're working on translation, and our next meeting will discuss how to best disseminate those surveys. Just a little bit of background on the MAT treatment, of course, stands for medication assisted treatment. And the services that have been provided through Mercy One's MAT in the past have been medications, labs, and physician treatments for substance use disorders. The funding that they've received through the county in the past has been used to help fund those that are uninsured Dubuque County residents. They serve 390, I'm sorry, not 390 individuals, 390 visits during the last fiscal year. The county has assisted with this funding for the past 5 years. And then as we know that it's time to enter or time for them to apply for another grant cycle. And those services are provided at Turning Point in the amount of $60,000 per year. This one is just to kind of get this. I know there's a lot of acronyms. I just wanted to get this out there because it may be something that you'll hear of in the coming months. The CDC has a smaller committee, and it's called NHAES, and it's the National Health and Nutrition Examination Survey. They're a mobile clinic, and they travel the country. They randomly select counties. Dubuque County was randomly selected to be part of this survey. They will be, they're in the very early stages of planning at this point, but they will be in our county from May through July. And so you can just watch for more information or listen for more information to come on that. What will they do? So they will actually, they'll work with the media to kind of get, they're looking for endorsements now. So they want to say, as the county, we're aware that they're here and we support them. They will actually go out into the community and knock on doors and elicit participants. Then they'll complete a survey at home. And then the second part of that is that they would actually come into these mobile units. I think it's like, it looks like 3 or 4 different trailers at once, and once connected, make a full health clinic. And so they do exams, and then they use that data to kind of paint a picture of what our community's health needs are. That's all I have.
Thank you. Concerning the strategic planning and the request for proposal, we do have a committee, and Amy is on the committee, I'm on the committee, Ally and Stacy, and we, like I said, we've been meeting every 2 weeks. Once we get these proposals in, the committee will go ahead and make a choice. Unless there's some objection to that from the board, but just in the interest of getting it to move along and keep it moving, we will just go ahead and make that choice unless you say otherwise. Okay. All right. And then on the last thing, Ally, that you spoke on, they were looking for support as far as a place to park, weren't they? And is that kind of gone away, or is that something you're following up on?
So there was a discussion about where would be the easiest or the most accessible place. I shouldn't say easiest place in the county. Ultimately, it's going to rest on their decision. So we
Okay.
did throw around a few different ideas. And I think the N. Haynes group will take the information that they've been given as far as the ideas and run with it and make
Okay.
their
Make their own decision.
determination.
Okay, all right. Oh, very good. Thank you for those reports, Laura and Ally. Next, we'll have the VMA monthly report and COVID update from Stacy Killian.
Good evening, everybody. So I've had some discussions prior to our last meeting with Sandra and Ally regarding reporting. And so my normal regular report with our grant updates and financials and everything's been included in the packet, but thought it might be more beneficial if I give a little bit different verbal report of just kind of what we're seeing in the community, how are we getting out in the county, trends and highlights and things like that. So the first thing I'd like to share is that for the month of January, we had a total of 1,304 services provided to individuals through all of our programming. So it was quite a busy month. Looking at services provided outside of the Dubuque city limits and out in the county, we had some oral health school screenings this month. We visited 2 schools, one in Piasta, one in Farley. We saw a total of 41 preschools. All of them received dental screenings and fluoride. We did provide quite a bit of presumptive eligibility for Medicaid this month, and it was actually up from what we've been seeing. So that was interesting to kind of watch and trend, but we had 2 children and 4 adults out in the county level that we provided PE applications and got those completed. We do informing services through our maternal and child health program, and we provide what's called informing services for all those newly enrolled in Medicaid. We explain how to use your insurance, where to go, help make sure they understand preventative exams, what's included with their insurance, and we screened 17 children for informing services out in the county this month. We have 3 parent education families that we are providing weekly visits to, so we had a total of 17 visits in the month of January. Currently, right now, today, we have 4 individuals receiving home care aid, homemaking services for a total of 18 visits in January. We spent quite a bit of time in the county for tobacco, providing 99 service contacts throughout the county. So we're definitely out and about. We vaccinated 63 children outside of the city limits of Dubuque. We have currently serving 13 maternal health clients, providing home visits as well. We saw 29 children through oral health screenings through WIC at our Dyersville clinic. And WIC in general saw 32 children out in Dyersville. We're currently serving 3 patients within First 5 and 5 patients out in the county from our Rhineway program. So we just started making this change. So hopefully I can have something more routine for every program we have, but there's kind of a snapshot of of what we're doing. So we're currently going out in the county once a month for WIC. We're expecting in March that we'll increase those out to a few more communities rather than having everybody come into the Dubuque office. That is one of our goals. And the same with providing immunizations as well while we're out there. So we're hoping to combine that. So just a few highlights of things that we've kind of seen or are working with. We received yesterday afternoon, and if I would have gotten it last week, it would have been in the packet, but I will give it to Ally and she can send it out to all of the board. Our childcare immunization audit results came in. So this year, with childcare, we do a portion of the childcares every year and we rotate through to try and get a good snapshot of where we are with our immunization rates. Through all the childcare centers that we reviewed, it was a total of 2,004 children. Of that, 95% had certificates on file, 95.16 to be exact. 1.45% had provisional certificates and 0.15% had medical exemptions. And 1.9% had religious exemptions. So total valid certificates within this group is 98.65%, which is a really great number. It's showing that we're getting in there, and the childcare centers are really working on the immunization factor. And we had a total of 1.35% that had no, they were either invalid or no certificates on file. So I do know our child care nurse consultant works a lot with the child care centers to help them make sure that they've got what they need on site, and then also help do the reviews to make sure all the kiddos are up to date prior to being audited as well. One of the trends I kind of wanted to bring up was Medicaid. Currently, they're going to be going through what they're terming the unwinding. And basically, it's due to the state of emergency ending. So every person is going to have to re-enroll in Medicaid. Over the last couple of years, there really hasn't been a real renewal process. And so this is going to cause a lot of barriers for individuals that may not see these letters come out in the mail. Officially, the start date is April 1st. And so mailing packets will go out to these individuals. We're encouraging everyone that comes through our doors. We're giving them a flyer on exactly what they need to do and encouraging them to call Medicaid, get their information updated as quick as possible so we don't see a lot of people fall off and have to re-enroll. We did develop some flyers that we're sending out to stakeholders throughout the community as well, and I'll include that and send that to Ally to give out to all of you. But it's something that's very concerning to us to make sure that all these individuals who really haven't had to deal with a lot of this over the last couple of years, it's going to be real and it could really impact their health. So something that we're certainly prioritizing. We also noticed Vicki Gassman, our tobacco coordinator, had noticed an increase in vaping and resources from health classes and things like that. So she's been trying to get more information out to the schools. She's also had a lot of requests for informational resources on both eating disorders and suicides. So it's something that we're certainly watching and getting that information out. As I mentioned earlier, we're also seeing quite an increase in presumptive eligibility for Medicaid. We're not the only ones that do presumptive eligibility, so I'm certain that other entities are probably seeing an increase as well. And then the last thing I thought I would highlight is part of our maternal and child health grants, we have to develop an advisory council for both. There'll be two separate advisory councils, one for maternal health and one for child health. And we're certainly targeting other stakeholders in the community, families that may have received services, individuals, who have a passion for both child health and maternal health services. So we're looking for anyone that would like to join those advisory councils. You can reach out to me and I'll get you in touch with Vicki. We'll start meeting for those in March. And I know maternal health, we're starting to get quite a good group, but I think we're still struggling a bit for the child and adolescent health. So something to keep in mind that we have that coming up. I think that is it for the highlights. Do you want to go with questions now, Sandra, and then go into COVID, or just have me get it up?
No, we can take questions now. I don't have any today. Does anyone else?
Stacey, can you give an update on the home care nurse? Or lack thereof an update? I'm afraid, is that where we are?
Yeah, we're still at a lack thereof, and we actually, we only have one on staff right now, and she went on medical leave, emergency medical leave. So it's very concerning to us. I did reach out to some of the other public health partners, kind of in our area, to see if they had any success in getting some of these. I know we've reached out to some of the private organizations that do homemaking, home care aid services to see they're struggling the same with staffing. We did change our positions that we have posted. We have full-time and part-time. We've also expanded our hours for evenings and weekends, which is something we didn't traditionally do, hoping we could get some students in there as well. And we've had our recruiters reaching out to the colleges and the high schools to see if we can get some applicants. I did have a couple high school students call me this week with questions regarding the position. So I'm really hoping that means that we might see some more. We still have 77 individuals, 78 as of today on the waiting list.
How about a travel agency, like a travel staffing agency? I
I've
mean,
never
the
tried that.
hourly rate would be higher, but at this
Right.
point, especially now that we have no one, I don't know, it just might be something to.
In the past, like we had struggles in our Clayton County office when we had staff out on medical leave. We had other staff step into their
Yeah.
role, and that's what we're doing here.
Yeah.
We have a couple case managers that are stepping in, so at least the ones that are currently receiving services, we're still able to get out as much as we can, so it won't completely stop. But it is pretty critical, because I think we could hire 6 people and still keep them full-time busy, which is concerning, but.
What is the starting pay?
Off the top of my head, I am not sure, but I can get you, we have a range that we go with. I can get you that and send it to you.
Is it double figure?
Is it what?
Is it a single figure, do you think, under $10 an hour?
No, no. No, but I do know one of the struggles we've always had is a lot of the long-term cares do pay higher than we do, and that's always been a struggle. They also have holiday pay, second shift pay, overtime, things like that, that we've just never had to.
Yeah.
And so we've tried to stay pretty competitive, and I know we've used the wage survey that Becky Nowiczek and the other public health offices kind of just to see what everyone else, and are we competitive, which in that group, we are.
Yeah,
With the long-term cares, it's a struggle.
right. And probably like with fast food restaurants or, I mean, they're probably all paying higher than that now, so. Okay. All right, thank you very much, Stacy. Any other questions for Stacy? Okay.
I'll go into the COVID.
Oh, yes.
then.
Yes.
Sorry, kind of broke it up. So looking at our COVID report and where we're at right now, our community level is a medium. And as you can see, when you look across the state there, there's quite a bit in the low. Low is kind of leading the state right now, but we still see some pockets of high. And then right around our general area, we're still seeing some medium. We're continuing to see the Omicron, and it hasn't changed in quite some time there, and on what we're looking at with variants. I did add this because I think this slide is very interesting, and it just kind of shows the trends of cases that we've had all the way up through February 14th. So you can see towards the end there, we're starting to take a dip again, but we're still kind of, luckily we have no spikes, and it's been quite a while since we've had a large spike, but it is kind of interesting to see how that trends out over time. The vaccine data, the numbers are very, very slowly crawling up. I think it was less than 0.15% increase from last month. So we're still getting some increases, but it's certainly nothing drastic or major, which I think is kind of to be expected. There hasn't been any changes in vaccine eligibility or any new vaccines coming out. So I think it's kind of where we're at right now. Looking at VNA, we're still continuing to track our calls, our vaccinations. As you can see, our vaccines are really slowing down. We are considering looking at where we're at the end of this month to see if we still need the Monday night clinics. We're keeping nurses there late to do these clinics, and we haven't had any walk-ins on Monday nights in quite some time. So we will kind of watch that though, because if we start to see an increase in vaccines for any reason, we can always increase and boost up our clinics. We are still continuing to offer the vaccine at all of our childhood vaccine clinics. So it is offered to every child that comes in to get a vaccination, as well as our open walk-in clinics, which to this day, I do believe we've never had a shutout. We've always had at least one. So that's good to see, except on Monday nights, but the MPOX, we're still continuing to see just slight increases from last month. I think it was 1 case increase since we met last month. So not a lot going on in Iowa, but across the US, we're still seeing some cases go up. Our influenza data, as you can see, we're very minimal, so I think we've kind of gone through that spike and we've certainly come down as well as our surrounding states, but we'll continue. Since we are still technically in the middle of flu season, that could go back up, so we'll continue to monitor that. And then looking at the next slide is the hospitalizations and seeing them go down quite a bit from even where we were a month ago, so that's good to see. And then the influenza vaccines, the red line is actually where we are now, and it's smack dab in the middle of other years. So certainly not lagging too far below, but would love to see that boost up a little bit. But we continue to offer those. We're still offering them for children through our office, as well as I know all of our partners are still doing it for if they have them available. So that is it.
Thank you, Stacy.
Yes.
Any questions about the COVID update from Stacy? Seeing none, we will move on then to action items. The first action item is a presentation, review, and vote on the MAT agreement with Mercy One. The reason this is on our agenda is because there was a previous contract and it ended in June, I believe, June of 22, but we were continuing to pay invoices without a contract. So I thought that we should bring this forward and see if we wanted to be involved in it or if we need to kind of table it until we get further information. And Ally has had contact with the Mercy One contact person with the MAT. And I believe she was invited to attend tonight, but wasn't able to, I don't believe. So we really do not have a presentation other than what's in our packet. Do you have anything you want to say?
I just know that she would have liked to have been present. It was short notice and completely understandable that they weren't able to be here, but would be more than willing and happy to attend upcoming meetings. So perhaps that's something that the board would consider
Okay.
in upcoming meetings.
I think we learned today from Supervisor McDonough that this really wouldn't be, we wouldn't be signing a contract at this point. They really need to, Mercy needs to apply through the Board of Supervisors for a point of service or whatever that's called, purchase of service. So it's nothing that we have no money for it. So we couldn't, if we wanted to be involved in it, we would only be involved trying to get funding. We don't have any funding right now. So I think it's premature to take a vote even as far as whether we want to be involved.
Have we been paying the invoices since? Okay.
But I don't believe we will be anymore. Is that correct? Or
We have paid some invoices outside of the contract period. It was recently realized.
okay.
And so I understand that services have been provided yet not invoiced to us that are also outside of contract, so that
when those invoices come in,
I think it's a question
you'll
of if-
deal with the county, like the budget person or somebody to make a decision about that. I mean, I don't think we can just keep paying. And I don't know for sure, but it doesn't seem like we should be.
Yeah, again, it's something that just came
Yeah,
to light, and certainly I will follow up
Okay.
as in whichever ways need to be.
okay. All right, I appreciate that. So I mean, I think we needed to have it on the agenda, but it probably is premature for any kind of vote. Moving on then, it has come to our attention that maybe we should make some changes in the COVID reporting frequency. Can you take that off now? Yeah. Where's our people? I'm just trying to see who's on Zoom because I was hoping Dr. Schultz would be available here. Hi, Dr.
I am.
Schultz.
Hey,
Um, Hi, would you have an opinion about what we should do about reporting COVID updates going forward?
I think we can reduce it unless we major shift. I've tracked this now for a long time, and over the last 13 months, it has been pretty flat and steady and not threatening by any means. So I don't think we have to report it on every session anymore.
Okay, and Stacy, you've been doing that reporting, is that right?
Correct. Just the weekly IMT report of what BNA has been
Yeah.
doing, and then also the PowerPoint for the Board of Health.
Okay.
Yeah.
So,
My-
do you think the weekly, should that be continued, the weekly IMT reporting, or is that not our decision, maybe? I don't know. Do you know, Stacy?
It is,
It is,
because it was
yeah.
just for, mostly it was just for Board of Health and,
Okay.
and
So,
Yeah.
how often do you think that should be reported now, Dr. Schultz?
I think at the moment it's, unless we see an uptick, and I mean, we will still track it. I think probably the information, the IMT information can go out monthly, and the report can go out that Stacy gives, the one that she gives today, can be quarterly. That would be my take right now. I would phase it out. Again, if the situation changes, we will learn soon enough, but I do not think at the moment, I'm not really expecting any big surprises right now.
Okay, thank you. I appreciate that.
And
Go ahead.
we can even roll it if we see the years more steady and things are slowing down further. We can also spread it out further. I think it's the right time. It's the right step now to roll this back.
Okay. Stacy, do you have any thoughts on that?
I think that's fine too. I think just even coming up with changes in the vaccine numbers are really minimal right now. I don't
Yep.
anticipate any changes, but we would hear about them through the state. So if
Right.
we felt something significant would change or a trend we would start to see, it would be something that we would alert through our regular reporting.
Okay.
And we
Yeah.
could make that change then.
Right. And Stacy and I can always touch base if she spots something. And I agree with the vaccines as well. I mean, we have now sufficient level of vaccination plus undocumented exposure and COVID disease that probably has immunized patients without bringing them even to the hospital, maybe not even to the doctor. So I think that is something that we're way beyond the initial stage where it was really very important information. I think now it is something that we can also roll back.
Okay, thank you. And Ally, do you have anything you want to add to that? No? All right, well, would anyone like to make a motion?
I can make a motion.
Oh. Okay,
What do we say? Monthly IMT reports, quarterly COVID reports in the Board of Health meeting. And I don't think we said anything about the vaccination reports, but I would probably do this the same as the quarterly reports, bundle it.
all right,
That would be my motion.
thank you. Is there a second?
I'll second.
I see that there's a hand raised on Zoom. Supervisor McDonough, do you want to say something about this?
I don't actually see the hand raised on Zoom. It's not me.
Okay,
Oh, there's the mouse.
all right, thank you. All right, so there's been a motion and a second. Is there any further discussion? Hearing none, then let's take a vote. All those in favor of the motion, please say aye. Aye.
Aye.
All those opposed? Okay, so great. That's a good sign. Yay.
Good sign.
All right, so those are our reports for the, or those are our action items for this month. The next item on our agenda is the response to public questions. And I didn't get any public questions this month, but I got several correspondences from Representative Charles Eisenhart. Number one, he would like the Board of Health to possibly get involved in a formal way on HF 261, which is a bill for an act relating to the disclosure of private well water testing prior to the transfer of real property. Now, I thought that was already a law, but I guess it's not. So that's just something that he thinks we should kind of keep an eye on, and I wanted to call it to our environmental specialist's attention to let her know that that's out there and maybe we should, take a stand on it. The next thing, Charles Eisenhart would like us to take a look at some things. There are laws or bills being proposed to stop Iowa schools from teaching about AIDS and HPV. It's SSB 1145. HSB 119 and SSB 1076. And so Representative Eisenhart was urging us as members of the Board of Health to contact people in our Iowa legislature if we are concerned about that. And then he also, in a previous month, sent out, he wanted us to start testing for PFAS in the county. And I was just gonna suggest that I was reading about grants to counties for the water situation, and there, it looks like there's some room that we could test for other things. So maybe someone from the department could look into, could we start testing for PFAS and arsenic when we are doing those water checks? Okay.
We do for
Arsenic. we
You
do,
are
yes.
arsenic, okay. So there may be funding for that PFAS testing, I'm just not sure. So that's something we could look into. And then two other things he was concerned about, and he wants the Board of Health to know about, are the education bills that are going through the Iowa legislature, and also the issue with lead and children. And so I guess he was wondering if maybe we need to, I think it's maybe part of our CHA chip that we're doing. Is that a problem here in the county? So those are the comments that I got from Representative Charles Eisenhart. We have some unfinished business. First of all, the status of the update of the enforcement procedure. We have gotten, like we said, we've got the Clayton County ordinance. We have been seeking other ordinances from other counties, and we've gotten 0 so far. So this is just hard. So I'd like to get at least one more from another county, and then Ally and I are going to work on a draft before we take it to the sheriff and everybody. So we're still working on it. The next is the update on the use of Mobile 1 unit for county vaccination push. And I don't know, Stacy, if you found anything out about that.
So I did. I reached out to Michelle Arnsdorf at Mercy One, and I had mentioned to her that this had been discussed through the Board of Health and looking for opportunities that VNA and the Mercy One mobile unit could partner and just even in any or all of our programs. And so she was very, very receptive.
Okay.
And she sent me some dates that she can meet with both Ally and I, and we can sit down. I thought maybe finding a way to possibly tailor it to back to school. We all know that that is a hard time for all of our providers trying to get the kiddos in. We know what happens with the provisionals and how it impacts our immunization rates. So we used to do, VNA used to do a large super shot Saturday. And we would bring in hundreds of kids and try and get them vaccinated. And maybe this is an opportunity that Mercy One and VNA could work together and do something similar to that, and maybe even add in some additional services. So she's very receptive. So I'll have more to report after Ally and I meet with her.
Okay, great.
Sandra, Ann has her hand up.
Supervisor McDonough, do you really have your hand up?
Yeah, this time I really do have my hand up. I should have reported on this earlier, but the Board of Supervisors did actually, everyone's making their budget presentations, and your budget moved through completely. We just have our final votes to set the levy rate. So we're coming closer. But I wanted to also indicate that the county attorney did put forth, he was not opposed to the Board of Supervisors considering hiring a civil attorney. He kind of let that be. He didn't think it was a bad idea. I guess I'll say that without trying to put words in his mouth. So that did make it through into our initial budgeting. So for someone who would be doing this ordinance and helping with enforcement and things like that wouldn't, even if that is in our final budget at this point, I think it is likely that will not be until July 1st that funding would become available. But I think there's some steps toward that. So I was pleased with that.
Good, thank you. That would be helpful.
Sandra, can I say something about the mobile unit, just maybe for Stacy and Ally consideration? I think something, if we're going to target kind of the back to school population, it might be interesting to see if we could get a provider for sports physicals. I think there's a big barrier to kids participating in school sports because they can't, parents can't get them in, or they can't afford. So if we could have a provider,
It would be really great to do that, add dental in there too. I mean,
Yes.
there's a lot that we could do,
yeah,
so.
that might be something to think about. Just reduce barriers to physical activity.
Absolutely, great idea. Any other comments?
I think it's great, this collaboration, Stacy, thanks for reaching out, because it's, the only we can do is grow from this, so thank you.
Next on the unfinished business is the Community Health Services Agreement with the VNA. The supervisors did approve that, and I've signed it, and I believe Stacy signed it tonight, and so that'll be, that's all completed, and that'll be sent in to the county right away. And the next item is, so that can come off of our list now as unfinished business. And then the PIO agreement with the City Health Department, which was passed in January of 2023. And that has also all been taken care of also. So we no longer have an agreement with them. I mean, it ended in the end of January, I believe. And so now Ally takes care of our PIO. That's Public Information Officer. And whatever invoices we had up until the end of January, Ally's asked for the latest invoices, and those will be paid, and then we'll be finished with that. So that's another thing finished off of our list. So very good. Thank you, everyone, for your help. Next, we have new business, and that's a review of the Board of Health Governing Body bylaws. This is just really a first reading. I think we have to do this a couple times, maybe. But what this is, these are our bylaws, our Board of Health bylaws. And the marks on this sheet are some really not real significant changes that are being recommended by Becky Nowacek. And so we just need to, have a first look at this. I think next month we can then talk about what we want to do with it and actually make changes if we want to. Do you have anything that you want to add to that, Ally?
No, other than, like I say, Becky's our regional consultant, so the recommendations that she has made will kind of help keep us in line with what other boards of health are doing in our area.
So we'll just have this on the agenda for next month too, and then I think what we'll have to do is take a vote on it at that point. Okay, the next item is, let's see. Board communication and reports. That would be from any of our Board of Health members. Is there anybody that would like to update us on what they're up to? Amy, I know you've been all over the place.
I have been, and
We appreciate it.
I don't think I have it on my calendar.
Okay.
It was just an update again about the February 23rd meeting at AEA in the conference rooms, I think 5A and 5B, through the Dubuque Area Substance Abuse Council. I think somebody from the Sheriff's Department, from the Drug Task Force, is coming and doing a speech. Am I correct on that date, Ally? The 23rd, February 23rd at,
Let me double check for you.
I think. I don't know why I don't have it on my calendar.
And that's different than the opioid settlement?
Yes.
Committee?
Yes,
Okay.
and if you can't be there in person, it will be available to be live streamed too. So that's probably why I don't have it on my calendar, because I didn't have the thing to say accept.
Yeah.
The 23rd in person thing, the 23rd at 1 to 2.
Okay, thank you. All right, does anybody else have anything they'd like to report? Hearing none, then our next meeting is scheduled for March 15th, 2023. And I just wanted to bring this up. One of our members said that he can't be here for that meeting because it's spring break for the schools. And I was wondering, do we want to change our meeting date? Is anyone else going to maybe be out of town because they're on spring break? No.
I am not, but I am not opposed to changing
Yeah.
to accommodate either.
Stacy mentioned
I
that
don't
she
know
won't-
yet.
Okay, Stacy won't be able to be here. I don't know.
Could we move it to the 22nd? The week after? Or the week before.
Would that be I mean, I don't know when spring break is for the schools, but, does anyone else?
I think it's the 13th through the 17th.
Okay, so the 22nd works for me.
That's fine.
Okay, why don't we go ahead then and move our, oops, I'm looking at February.
Same time, 4:30.
4:30. Move our March meeting to March 22nd at 4:30, just to avoid spring break issues. Next on our agenda are public comments. At this time, anyone may address the board on matters of which are of concern to that person and which are not agenda items. Please raise your hand if you're on Zoom or stand up. If you're in the room, state your name and home address. Please be aware that the board is limited in their ability to respond to such inquiries, and the Iowa Code prohibits the board from deliberating or acting on items not appearing on the agenda. Individual remarks are limited to 3 minutes. Are there any public comments? Who has their hand? Oh, okay, yes, Miss Caitlin.
Hello, everyone. I won't go 3 minutes. I just wanted to introduce myself. I am on the Food Policy Council and happy to be at this meeting, first health meeting I've come to. The Dubuque County Food Policy Council, I think, is like a dream team of people who are experts in food policy and also boots on the ground people. We did a really great strategic plan last year, and we've been in a holding pattern ever since because we just don't have any resources or support to continue our work. So I'm hoping that we can liaise and work well with you because food policy is an important part of public health. So I look forward to working with you to incorporate and implement our strategies and policies as we can and making public health throughout Dubuque County more robust as a result of that. So I just wanted to introduce myself and thank you, Supervisor McDonough, for your kind words as well. Thank you.
Thank you for introducing
you.
yourself. It's nice to meet you, and we do look forward to working with the Food Policy Council and collaborating with you. So we appreciate that. Thank you very much.
Thank you.
Anyone else have any comments? Public comments? Hearing none. Yes,
Yeah, you want me to stand?
you can stand up, yes.
Hello, my name is Victoria Allendorf. I am the executive director of a federal nonprofit called I Hate Heroin. I also happen to be a Medicaid behavioral health case manager for AmeriGroup. I understand the Medicaid piece very well and struggles. I just wanted to first of all thank Ms. Larson for inviting us today. Diane and Lori are here with me. And Diane's going to speak. She has a particular ask from the group that I'm here to support. But I did want to ask if it is possible, like you mentioned before, I think Ann mentioned having Evan on the opioid subcommittee. I think that would be critical to have somebody with that kind of experience to sit and meet with you. Like we say, nothing about us without us, and it's kind of critical to have people who are working in the community. We know the exact barriers we're facing, whether it's with the MAP program or the naloxone distribution or anything like that. So that would be an ask from us. And I just wanted to say personally that I wanted to thank everybody in the room who did help with that agreement with Mercy One. The MAT component in our community is critical. I am a mother who lost 2 children to fentanyl overdose in 2016 on the same day. And the program, the MAP program at Turning Point saved my other son's life. So he was a recipient of Suboxone. He's still on that, but he's been at John Deere for 5 years and he's now a supervisor. So I just can't say enough that this MAP program changes people's lives and it saves lives. So I just really want to thank anybody who supports that and helps us out, you know, in the funding for that. So
Thank you very much. We
Thank you
appreciate
so
it.
much. I'm Diane Hyken. I'm a retired pharmacist and I worked in children's behavioral health, and I used to be a Board of Health member. And originally I wanted to come and ask that you would form some sort of a subcommittee or task force or work group, not knowing that it was going to come out in your report, Ally. So thank you for doing that. And I echo what Vicky says about Evan hopefully being able to be on that committee, but just also in general, if you can really understand and appreciate and acknowledge the value of people with lived experience. Having been on all kinds of committees and other work groups and things like that as a licensed professional, I can tell you that when I got involved with these ladies, I saw so much more get done because of their lived experience and their insight to how things work. So, and I don't want to tell all of their stories, that's for them to tell,
Right.
but it's not just people who use drugs, but it's also their family members that I think you'll find have invaluable insight and experience, and they are just so motivated to just not give it up, not give up the fight. And I'm sure they're very tired. They've been working on this for years. So one of the things that we had been working on probably 4 years ago, I think, and I think we brought it up at the opioid settlement meeting, which Allie, you were there, was the locks boxes. And that's just kind of a specific topic. But just in general, I would like you to look at increasing the lock zone access and distribution as soon as possible. If that can be a target of that committee, that would be great. There are a couple opportunities that are coming up that are new and exciting. I've talked to some people at the Department of Health and Human Services, and they feel the same way. So right now, you know, basically you have to get it somehow through a licensed professional like a pharmacist, but the governor had said in her condition of the state report that she wanted to increase that access, and I wasn't sure how she was going to do it. So one way is she has put out a bill, and it's tracking through the House and the Senate at the same time. And it's mostly like I've heard it called her fentanyl bill or a drug omnibus bill, but within that is a piece that creates a new definition called secondary distributors. And within that definition is a county health department. So I don't know what it will entail to be a secondary distributor. So I reached out to the governor's office, and today they did give me the contact name, a woman named Laura Book, that could help kind of clarify that, because I don't think it's anything that's ever been done before. We've not had secondary distribution available. The other thing is that it may be over the counter. The FDA is set to announce on March 29th their decision on Emergent, who is the company that manufactures Narcan, the nasal spray, the pre-assembled one. Their application, I think they submitted it in December. March 29th, they may announce that it's over the counter. Now, how they will distribute it, I don't know. Where Dubuque County would sit, you know, in a line of people that are going to be waiting to get that immediately. You know, I don't know that either. So I don't know if you could start reaching out to Emergent, looking at the distribution programs. There will also be a lot left over through the public health department's stocks, I would assume, but once they're labeled RX only, they would still have to dispense them through their programs like that. But anyway, if you can look at naloxone access and distribution, and try to be proactive with these new opportunities, because it seems like with opioids, we're always way behind. And that's, I mean, everybody has been. We've always been chasing this problem. So the treatment programs, it's wonderful. We need to build that up too, obviously, but we need to keep people alive so that we can get them into treatment.
Thank you.
Thank you.
Appreciate you coming. Anyone else like to speak?
Well, sure, well. I'm Lori Peter. I am the mother of a son who died from heroin. I also am a detox nurse, but I'm sure you guys heard me say this before. There is no detox here. I work in Illinois in Rock Island. I did work in the Quad Cities at Country Oaks, and they closed their detox. So I believe Iowa currently has 3 detoxes in the entire state. So even if we have people who want help, where do they go? That's basically that's where I'm at. I mean, we have nothing.
Right.
And that's really sad. So I would hope you would keep that in consideration too, going forward with anything that's available that and your part in it, you know, with the money that's going to be.
Exactly. Thank you. We appreciate it. Thank you. Thank you. Any other comments from the public today? Seeing none, is there a motion to adjourn?
And second.
Any discussion? Hearing none, all those in favor of adjourning, say aye. Aye.
Aye.
Motion passes. Thank you, everyone.
Thanks, guys.
Thank you, everyone.
Thanks.
Thanks, Ann.
Thank you, everyone.